And thank you for joining us. We have Dr. Jeremy Gebhart and Jay Parker from Orthopedic Associates of Meadville. Gentlemen, thank you for being with us.
Thanks for having us.
Thank you.
Dr. Gebhart, let's get into your specialty, and we're going to talk about hip and knee replacements.
Yep.
Let's get into that.
Yeah, so I'm an orthopedic surgeon. I've been here in Meadville for the past 5 years. I specialize in hip and knee replacements, so that's about 95% of my practice. I also do some call cases, so broken hips, broken ankles, but the vast majority of my practice is just hip and knee replacements.
You know, you go back a couple decades and somebody needed a hip, a knee, and it was, okay, what's going to happen? What's the rehabilitation like? So much has changed. In the time that you've been practicing, just what has technology done? What has rehabilitation done? I mean, again, it's night and day.
Yep, exactly. You hit the nail right on the head. So hip and knee replacement in general, they're two of the most successful, highest patient satisfaction surgeries in all of medicine. That's why I do them. It's fun to be in clinic and see patients coming back and doing very successful very quickly. And it's been that way for many years, but the big focus now is getting people back to normal activities more quickly, accelerating recovery, and kind of fine-tuning the surgical process to make the outcomes even better. Big advancements even in the past few years are getting people moving more quickly, getting people back to normal activities more quickly. And we'll talk a little bit today about robotics in surgery. That's a big thing in the past few years especially.
What sort of questions do you get from patients coming in to see you prior to surgery?
Yeah, people are generally very nervous about the recovery because a lot of people have had family members who've had a hip replacement 15, 20 years ago, and they saw them spend a week or two in the hospital and then go to a nursing facility afterwards. So I think there's a lot of anxiety about that. And then, like I said, people want to get back to their normal activities and get back to that fairly quickly. So they want to know about that recovery process and how long it'll be until they're back to those things.
And it's not uncommon for you to have somebody ask you, listen, if we get this done now, I can be back out golfing or playing tennis by this date, or baseball, whatever it is.
Yep.
Is there any, I would imagine that the quality of not the work, but of the replacement in themselves, how often does that come up? Will I be able to, am I going to function at 100%, 80%? What's life like after the operation?
Yeah, it's funny you mentioned golfing. That's probably the number one activity that people want to get back to, and the number one question I get as far as people asking, when can I do that stuff? And again, the whole point of surgery is to get you back to doing that stuff pain-free. I think with modern day advances in joint replacement, a lot of it is holding people back from getting back to that too quickly because we fix the joint, but it's also a soft tissue procedure where the soft tissue around the joint has to heal. So that's a big thing nowadays, is just kind of holding people back, especially with hip replacements. That hip's a little bit easier to recover from compared to a knee.
And it's not just somebody steps the wrong way or somebody falls. I mean, there's that aspect of it, but patients that are coming to you maybe have had years of pain.
Yep.
Talk about just some of the things that they tell you and why they're coming to see you.
Yeah, usually the people will have pain for many years. So it's developing arthritis is a combination of genetics, wear and tear, and injuries to the joint. So a lot of people will have a history of all the above. Family members who have had arthritis, prior surgeries to that joint, prior injuries to that joint. Typically what brings people to my office as a hip and knee replacement specialist, where they're starting to consider surgery, is when it starts to interfere with their activities of daily living, when it starts to prevent them from doing things they want to do. I know with Jay, he'll probably talk a little bit about this, but he was saying, hey, I can't make it through 18 holes of golf, or when I swing a certain way, my knee starts to hurt. And another big thing is when it starts to affect their sleep. So when people are waking up because their joints hurt, that's when they typically come to see me.
We can save this answer for afterwards, but I'm sure you also hear after everything's taken care of, I should have had this taken care of years ago.
Yep.
Jay, let's bring you into the conversation here. Jay, you have experience both personally and professionally with Dr. Gebhart. Kind of tell us about that.
I started at the hospital in 1980. I'm currently the director of surgery and central processing, so 44 years worth of medical terms. 16 of those years I worked with Orthopedic Associates of Meadville and private scrub for the doctors. So yeah, I saw it firsthand where the 7 to 10 days in the hospital, and after that you go to rehab for so many days, and very slow recovery. So I had come 7 years ago, I had my meniscus taken on my knee with a knee injury, and now we turn around and it developed into arthritis. And I had been seeing Dr. Gebhart for the past couple years, getting injections and everything. And then last year it got to the point where, I was using my putter to get around the golf course like a cane. And I said, and went in and got the x-rays, and he said, wow, he said, that's, it's not going to get any better. And so that's when we went ahead and scheduled the surgery. So.
And by the way, you could still beat me on the golf course doing that, but no, you wanted to have a much better game and more enjoyable game, too.
Yeah, I had to get it down by 5 strokes so I could beat my partner.
So were you also seeing the change in just technology and how the procedure was done, and just what has changed over the years?
Yeah, so, 2 years ago, the robot was not in existence for us, and the thought of bringing a robot to Meadville had not really been mentioned until about a year or so ago. And that's when I started doing my research on it, looking into it, and the hospital said, hey, this is good, they have good outcomes, it's better for the patient, it gives them, Jeremy could tell you about you take a stylus on the inside and it gives you 3,000 data points for them to make their cuts. And so, all I can tell you is I had mine done at my 2-week visit. I walked in without a cane. I was able to start driving at that point. At 4 weeks, I went to work part-time, came home and I had to ice it in the afternoon. And at 6 weeks, I worked full-time, and I was golfing by 11 weeks, so it worked.
And we can talk a little bit more about that in a moment. I'm just curious, though, for you, Dr. Gebhart, the robotic part of this, and you can get into the specifics. Obviously, this is a tool. Mm-hmm. You have to have the experience and,
exactly, yep.
and the knowledge still to be able to do that. But what does that say to you when Meadville Medical Center is looking at you and saying, hey, let's invest in this. This is good for us, and the department is outstanding. We want to keep that level of success.
Yep. Yeah. Going back to even when I first started to look at Meadville as a potential for a job, I was trained in kind of big-time academics. So I did my training in Cleveland, St. Louis, some of the biggest academic hospitals in the country. And I kind of told myself, wherever I work, I want to have access to the best, the latest technology. And I grew up in Western Pennsylvania. I wanted to be back in Western Pennsylvania. But I also didn't want to be at a hospital that was kind of stuck behind the times. And Meadville kind of had this rich tradition in orthopedics that they were always a leader. And I say this all the time, Meadville is a small town, it's a small community hospital, but I am 100% confident that the resources available, especially orthopedic-wise, they match any major academic hospital in the country. And when I kind of presented the data that, hey, robotics is the future of joint replacement and we need to be there and take that next step, I had the full support of the hospital, so it was nice.
Jay, 50 plus years of this department that's been doing outstanding work. You have to smile knowing you're making a difference. Yeah, so
I've been in charge of surgery for 18 years, and across every specialty we have, whether it's urology, orthopedics, OBGYN, general surgery, the equipment that we have at Meadville Medical Center is the top grade, the best that you can get. And like Doctor said, any hospital that you go to, sometimes you're 3 tiers down to receive the equipment and be eligible for it. I present this to administration. Administration met with Dr. Gebhart, and they were all in. So it's not a matter of, we're just going to do this because we're a small, surgery center or something like that. We have the equipment that we need. Like I said, I scrubbed with previous total joint surgeons, with previous back surgeons, and I still get to do that. And the equipment we have today is state of the art, and local facilities some of them do not even have that.
Does it also help in the decision-making process when you have somebody like Dr. Gebhart that's going to be operating, and just the level of quality you have behind the technology?
Most definitely. Because I have to deal with the statistics. If we have any infections, if we have any problems with surgeries, with the patients afterwards and that stuff. And, we follow that up all the time. And he's top ranked.
That's wonderful. Dr. Gebhart, you mentioned just the level of quality you get here. We talk all the time that it seems like patients aren't a number here. You know their names. You see them out.
Yep.
Jay, I'm sure you see patients that are out playing golf, doing
Yep.
things now. What's that say to you when you see them active and engaged and knowing that you had a role in the health of that patient?
I mean, it's really nice, and it's one of the things I love about being in a smaller town. And it was actually funny you bring that up. Actually, last Sunday we were in church, and we were driving home with my wife, and I actually said, I think I've operated on more than half of the people that were in church today. But it also puts a little bit of pressure on you too, because every surgery, somebody in that operating room knows that patient. It's a family member, and I take a lot of pride in that too. So I think everybody in the entire hospital does, especially in the ORs, because everybody's a little extra special. So.
Yeah. And Jay, for you, it's the same. You know, you're out in the community, you see people are talking to you. There has to be that level of pride, knowing that, yeah, we're going to take care of you. We're going to make sure you're okay.
And people ask me, because they know who I am. I've been around here for a long time, and they know who I operate, who I work with. Hey, who do I need to see for this? Who do I need to see for that? And we reloaded all of orthopods in the past, 5 years.
Yep.
And the guys we have brought in are absolutely top of their class. They are outstanding, and I personally operated with most of them. I haven't operated with him yet, so. I go in and
You were sleeping. You were there. You just were sleeping.
No, I was awake.
Oh,
Yeah, he was
I
actually
was awake.
talking to me during surgery.
I was awake.
Wow.
Yeah, so that doesn't happen often, but I said, people want, why would you do that? I got a difficult airway, but the other thing is, I wanted to hear them cut the bone. We cut bones for so many years, and when you cut the bone and it's like butter and it goes, I'm like, and I said, I wanted to hear that, and I said, as sick as that is, but that's from doing so many surgeries. And I just sat there, and I was wide awake talking with the CRNA, and I said, that's good.
Now, so you might have a different perspective because you're there, but what do people say to you? What are the concerns that you hear, and what are you saying to them?
Well, I mean, people want to know, hey, am I going to get better? What's their success rate? How many infections have they had? How many, bad joints have they had, and all that stuff? And I can tell them, every one of our numbers are either at the highest for good or at the lowest for bad. And we have great outcomes, and we have a great therapy department. And if you look at the whole situation from the time you walk into the hospital, when you go into GSCU, you have your IV started. There was 4 people. One's shaving my knee, one's doing an intake, one's starting an IV. And within an hour later, I was getting a block, which that block lasted almost 3 days before I had any pain at all. And then they did a spinal before, once I was in there. So we have 3 rooms running for him. It is a very systematic design. He has 3 teams dedicated to him, so while they're finishing up in one room, they can start in the next room. They're setting it up in the 3rd room. So it's a definite process. And everybody I talked to, they said, I have never seen anything like that. And it's just like, so.
Well, Dr. Gebhart, for you, obviously there's the overall aspect of making sure your department is doing what it needs to do. But is there any thought into, okay, the aftercare? We have to make sure that rehabilitation is doing their thing. Like, everybody's firing on all cylinders.
Yep.
So is that important to know that, again, Meadville Medical Center invests in making sure the right people are in the right positions?
Exactly. Yeah, I tell everybody we can do a perfect surgery, and we can give each other high fives after surgery, and we can get x-rays and they can look perfect. But a lot happens before surgery and after surgery that's not our team, and that's everybody else at Meadville Medical Center and throughout the community with therapy programs, with home health agencies. So it's definitely a whole team sport for sure. There's actually some pretty good recent data, and they looked at the number of healthcare individuals that a person encounters throughout the joint replacement process, and it was some outrageous number, like 400 or 500 people, between all of your preoperative appointments, lab work, preoperative nurses, all the folks you're encountering in the operating room. We have 8 or 9 people in the operating room for every surgery, all the aftercare, so it's definitely a whole team process.
That's incredible. And even just the simple phone call to get things set up and to make sure everything's in place. I mean, all of that's important.
Yep, exactly.
Yeah.
Yep.
Well, they're pre-op visits. You go for your pre-op visit, you have your x-rays, you meet the doctor, you get your permit, you meet the pre-anesthesia team, all your blood work, everything's done in one shot. You're not going here this day, here the next day. Everything's done in one shot. I only had to go there once. I was done. I was all set up.
And that mentally has to be great for the patient, because now instead of dragging that out for days or weeks, now, okay, it's just happening. Boom, boom, boom.
Yep. Yeah, that's one thing over the past 2 to 3 years we've really taken or made it a priority to make it convenient for the patients. I think that's another thing patients are looking for, especially nowadays where they don't want to take time off of work for the process. They want to get back to things as quickly as possible. We want to make things as easy for the patient, as convenient for the patients as possible. We actually have quite a few patients that come from pretty far out of town, from New York, from Central PA. Meadville has always drawn from quite a wide range of areas as far as orthopedic patients. So those people coming from out of town, it's very convenient for them that we knock everything out with one appointment and have them teed up for surgery after a couple hours.
Talk about the robotic assisted, just the part of all this, the procedure part of it.
Yep.
It has to be pretty amazing. Again, the technology, we've talked about that, but what doors does that open, being able to offer that?
Yeah, so I kind of mentioned this earlier, but robotic surgery has really taken off in the past few years. I think that's the future of, especially with knee replacement. And part of the reason why is, I kind of alluded to this before, but hip replacements, they do great. We do anterior hip replacements now, pretty rapid recovery. It's pretty hard to find a hip replacement patient that's not very satisfied. They recover very quickly, very minimal pain throughout the recovery process. Knees are very successful, but we do know that there's still a handful of patients that just aren't satisfied. We can do a perfect surgery, their x-rays can look perfect, but they say, you know what, this knee isn't what I anticipated. And we know that's 10, 15, even up to 20% of patients that aren't completely satisfied with their knee replacement. So over the past few years, we've really been looking at ways that how can we make that 10, 15, 20% of patients 1 or 2 or 3%. And I think robotics is what's going to take us to that point. And with the VELYS robotic assisted surgery that we're doing here in Meadville, there's a couple other robotic systems throughout the United States especially. Basically what it's allowing us to do is we're still doing the surgery. It's just another tool in the toolbox. But what we do is during surgery we actually map out the knee, okay? So with this particular system that we're using here, it has a special camera, so we have trackers on the knee. Takes thousands of pictures per second, so we actually map out the knee during surgery. That allows us to plan the surgery kind of live time. So we're planning our cuts down to the 0.5 millimeter, down to 0.5 degree. We also balance the knee throughout surgery. So we stress kind of the soft tissue envelope around the knee. And we're basically putting the knee replacement or aligning the knee replacement in the joint to whatever is the most soft tissue friendly. And what we're finding is people are generally recovering more quickly. They say the knee feels more natural. And I think another thing we're going to find is that the implants last longer because it's kind of in that perfect sweet spot in the knee joint, so it doesn't wear out as quickly. So,
where do you see this in 10 years?
Yeah, so that's another exciting thing is we're just kind of scratching the surface of where robotics can go. So it's very exciting to see where it's going to take us in the next few years. A big thing that I think it's going to be kind of the next step is using robotics for revision surgery or redo surgery. I don't think the technology is quite there yet, but I think that's the next step with things.
Do you still get questions on how long will this last, knee, hip?
Yep. So traditionally, people would say 10, 15 years, just because we kind of didn't know. With newer implants, newer implant designs, newer technology, better ways of doing surgery, I tell people that this implant is probably going to last you 40 or 50 years, or there's a very high likelihood of that.
Wow.
So basically anyone over the age of 45 or 50, I tell them there's a very high likelihood that this implant will last you the rest of your life. You'll never need any sort of further surgery.
That's fantastic.
Yeah.
People ask, is this like Rosie the robot from the Jetsons? You know, she's doing the surgery. I said no. And the surgery's done by the surgeon. Go ahead.
Yeah. Like I said, it's just another tool in the toolbox.
Jay, for you, just talk about coming out of that, being able to go back to life, not having that pain. That's something you probably said to yourself, I should have done this years ago?
Oh, definitely. I mean, I didn't know it was as bad as what it was. And that the last, we always told people for 100 years while I worked for the orthopods, you want to wait and wait and wait till you can't do your activities of daily living. And that's what was happening to me. I said, couldn't ride the motorcycle, I was trouble, putting weight down on that, trouble walking with golfing, hunting, couldn't go very far in the woods without any, uneven ground. It was terrible. So it's definitely, it's a game changer, and it puts you back into the game and be able to do the things you want to do in life.
And around here, people, they maximize the use of their bodies, right? The work hard, play hard concept. Jay, you mentioned golf, riding motorcycle, getting out in the woods. I know people tell you, hey, I'd like to get back to doing this, but I have pain. Well, don't be afraid. Schedule that appointment and get that conversation going. Dr. Gebhart, for you, what do you do to relax at the end of the day?
I love to be outside, basically anything outdoors. I'm not much of a golfer, unfortunately, but I love to hunt and fish. I grew up on a dairy farm, so I've always loved being outside farming. I actually just got some land here in Meadville, so doing some hobby farming. So
excellent.
Yep.
That's wonderful. Guys, I greatly appreciate the time. This was fascinating. If folks want to learn more, how do they get the information? How do they start the process of having these conversations?
Yeah, so our telephone lines are always open. We have a website. I tell people if you're having joint issues as well, it's always a good idea if you make an appointment with us. It's not committing to a joint replacement. There are many, many steps prior to a joint replacement. There's physical therapy, there's injections, there's all types of stuff we can try. It's always a good idea just to get a baseline, A, so you know what's going on, B, so we can kind of track that over time. Again, it's by no means, if you make an appointment, you're going to be on the operating room the next week. It's usually quite the process where we follow you for years or if not decades, where you're getting injections, trying therapy, things like that before we commit to anything. So,
Jay, you said it earlier, but just kind of recap, this department and this hospital.
So surgery is, we're seeing more patients than we ever saw 10 years ago. And it's due to people coming in for, people like that we have here. And the caliber of each of the surgeons, anesthesia, the RNs, the techs, everything that we have is top notch. We do it the right way every day, and we have great outcomes.
Perfect. Guys, it was a real pleasure. Dr. Gebhart, Jay,
Thank you.
Thank you for your time. And we want to thank you for joining us here today.